Welcome to Bisexual Men Uncovered, the space where we talk openly and honestly about men's health, sexuality, and the bodies we live in. Today, we're zeroing in on one of the most overlooked yet essential parts of the male anatomy: the testicles. Whether you call them balls, nuts, or just the boys, they do a lot more than you might think. This episode is all about what testicles are, what's inside them, why they matter for your health, and what they can tell you about yourself. Let's break it down, with facts, not shame. Segment 1. What are testicles? The testicles, or testes, are two oval-shaped organs housed in the scrotum, that pouch of skin hanging behind the penis. They're part of the male reproductive system, and their main jobs are producing sperm, the cells that fertilize eggs; producing testosterone, the hormone that fuels your sex drive, muscle growth, facial hair, and even mood. Fun fact: the word testicle comes from Latin testiculus, a diminutive of testis, meaning witness. Ancient Romans believed your testicles witnessed your masculinity. Wild, right? Segment 2. What's inside a testicle? Inside each testicle, it's like a biological factory. Seminiferous tubules, tiny tubes where sperm is actually made. If you stretch them out, they'd be almost 700 feet long per testicle. Leydig cells. These produce testosterone. Epididymis. A coiled tube on top of each testicle where sperm mature before they're ready to move out during ejaculation. So yeah, your testicles are constantly working even when you're chilling. Segment 3. Why testicles are outside the body. Ever wonder why your testicles are just hanging out there? It's not a design flaw. It's a biological necessity. Sperm production needs a temperature a few degrees cooler than your internal body temperature. Keeping the testes outside the body, in the scrotum, helps regulate that. The scrotum can actually contract or loosen depending on the temperature to keep things optimal. Hot? It relaxes. Cold? It tightens up. That's your body protecting your sperm. Segment 4. Why the skin is different. The skin on your scrotum is unlike anywhere else on your body. Here's why. It's thinner, to help with temperature control. It's more flexible and wrinkled, for expansion and contraction. It has a lot more nerve endings, which brings us to, yes, sensitivity, which is a double-edged sword, pleasure and pain. That leads us to Segment 5. Why are testicles so sensitive? There's a reason why getting hit in the balls feels like your soul is leaving your body. Testicles are packed with nerve endings. Evolution made them sensitive for protection, because they're essential to reproduction. Your body says, protect these at all costs. And the pain can radiate up into your stomach? That's because of how your testicles connect to your inguinal canal and abdomen during development in the womb. So, pain travels. But here's the twist. Those same nerve endings also make the testicles an erogenous zone. Many people find testicle play arousing when done gently, consensually, and safely. Segment 6. The role of testosterone. Testicles are the body's main testosterone factory. Testosterone affects libido and sexual performance, energy levels and mood, muscle and bone strength, facial and body hair growth. Even your voice, low testosterone, aka low T, can cause fatigue, erectile dysfunction, loss of interest in sex, and even depression. So if your sex drive drops suddenly or you feel unusually drained, your testicles might be telling you something important. Segment 7. What your balls say about your health. Your testicles can actually be a window into your overall health. Here's what to watch for. Lumps or swelling. Could be a cyst, varicocele, or rarely, testicular cancer. Changes in size. One might shrink or grow due to hormone issues or infection. Pain or discomfort. Could signal a torsion, twisting, infection, or injury. Vein-like bulges. May indicate varicocele, which affects fertility. Monthly self-exams can help you catch problems early. Just feel each testicle gently with your fingers in the shower. Look for anything unusual. Segment 8. Balls, Gender, and Identity. Let's be clear. Having testicles doesn't define masculinity. Plenty of trans men, non-binary folks, or intersex individuals may or may not have testes. That doesn't make anyone less valid. But for people with testicles, understanding them is part of body literacy and body autonomy. Whether you're cis, trans, gay, bi, or anywhere in between, owning your body knowledge is empowering. Segment 9. Tips for testicle health. Let's talk care tips. Wear supportive underwear during sports or exercise. Avoid too much heat. Hot tubs, laptops on laps, tight jeans. Hydrate and eat well. Sperm health depends on overall nutrition. Limit alcohol, tobacco, and drugs. They can lower testosterone and sperm count. See a doctor if anything feels off. Wrap up and call to action. Your balls aren't just body parts. They're powerhouse organs that reflect your health, hormones, and more. So treat them with care, check them regularly, and don't be afraid to talk about them. Knowledge is power, and shame has no place here. If you liked this deep dive into male testicles, hit like, subscribe, and share this video with someone who needs to learn more about their own body. This is Bisexual Men Uncovered. Thanks for watching, and keep exploring.